Hello, everyone. I'm very happy to meet you in this platform. And thanks to Turkish medical travel executives to arrange that webinar and bring us together. It is weird to not to see you and try to emphasize what we're doing, but hopefully in a close period of time, we'll be physically in touch again, probably in the second part of this year. So I just would like to brief about Liv Hospital to you. And I would like to present ourselves as a group and Liv Hospital, our affiliation with Istiroti University, and would like to focus what kind of scientific approaches we do, the technological infrastructure we handle, and some of the specialized clinics are taking place, and there are special projects and upcoming projects. So we are part of the biggest medical chain in Turkey. We are performing in 15 cities but with 31 hospitals, and we have another with 2 brands. And we have some new facilities that I will mention soon. So in MLP Care, the mother company, we exceeded 2,700 physicians already, and Liv Hospital owns 454 physicians, 80% being academic staff as well. And I would like to explain that we have been, since our opening in 2013 as Liv Hospital, we have been performing to international arena, and therefore we have got the second prize in the service export category in the last 2 years, in 19 and 2020. And we have been given by the Ministry of Economy the Quality brand, which means that we have the Liv brand can introduce itself abroad, and the Economy Ministry will support the introductory and service line costs. What Liv means is our name comes from leading international vision in healthcare. From the day one, we wanted to compare our medical results with the best practices abroad to enlarge to worldwide, to make sure that we're going on the right path in every clinic. And our service area is approximately 200,000 square meters and 1,400 beds, just Liv hospitals. And now we're another hospital we have on the way is on the European side of Istanbul, and it will be our last Liv hospital this year. In these challenging days, we're really having too much adrenaline by opening the biggest Liv hospital in Istanbul. And sometimes whenever we discuss with our agencies, ministries abroad, they ask about the capacity. And I say that we are lucky in the capacity of Liv Hospital as well as the MLP Care with 31 hospitals. So besides the specialized centers, we always have the potential to hospitalize and serve many patients around the region. So you can see the infrastructure of our first Liv Hospital that has been opened in 2013. So the satisfaction of our guests are very important for us. Where they live and how the process is important as our medical outcomes, our focus on medical outcomes. You know, the hospital infrastructure has developed tremendously. So we want our guests to be in very calm and soothing environments. So coming to our international guests, so far in the team, we serve them in 20 languages. Sorry that I can't speak Russian at the moment, but since we have a lot of Russian-speaking countries, I hope to make my next speech in Russian in the coming years. So our guests have come from 135 different countries, but the majority, the breakdown is majorly MENA countries with 32%, CIS countries with 21%, and the rest comes from Uzbekistan, Kazakhstan, Azerbaijan, Bulgaria, Georgia, Romania, and Europe countries majorly. In Georgia, we had a radiation oncology center that we were running for 4 years. So we enter in not only in treatment in Istanbul, but we are in projects where we manage clinical-wise some facilities abroad. So some of our international offices are in Balkan countries, Georgia, Ukraine, Uzbekistan, and some in Africa. And we're developing the network as being part of Turquality brand. We have the capacity now to go faster. And we are an affiliate of Istinye University. We have the medical, our physicians started the medical faculty in Istinye University in 2016. Now we're in the 5th year of the university, and they have many faculties at the moment. So we have a very developed research and development laboratories, as well as clinical services. So we have exceeded by now 8,000 students, and you can see the number of foreign students and foreign medical students from different countries that you can see at the right. So there is a great diversity of international students in our medical faculty. And in this university, we have health and sciences research centers on research and development centers on stem cell, molecular cancer applications, neurological sciences, and three-dimensional design and prototyping applications. And our health service laboratories are diversified, and our clinics work hand in hand with these RD centers. So you can see our faculties, and we provide medical education in 2 languages. So we care about the scientific production. We do international programs and publications. And so far you can see, since our opening, the number of scientific publications that we have accomplished. Even in 2020, where we were fighting in the field with COVID patients and the rest, we continued our reproductions of the researches. And every year we perform international programs and workshops, jointly with our international affiliates. You can see some of them from Memorial to Cleveland Clinic and Johns Hopkins. So we do several programs. Majorly, we handled cancer-oriented programs, and it's again diversified in different specialties that I will describe later on. And recently, we started the International Contemporary Medical Academy of Science by international founders and local founders, that now you can enter to International Medical Academy website and see our programs. It will be online free programs on many specialties, from oncology to orthopedy to robotic surgery, cardiovascular surgery, advanced cardiological interventions. So each month is the short term of this category, where all the attendees will have a certification by Liv and Istinye University, and we're inviting all of our physician partners to join in and share their experiences. So, of course, accreditations make a corporation more trustable. So since our start, we had a lot of accreditation programs, and we started to have Center of Excellence accreditations from an independent organization in US for colorectal surgery, bariatric surgery, and robotic surgery. Later on, we became part of our spine, which is a European spine center, and they have accomplished us as education center. We're part of the breast center, national breast center in the States. So we keep on getting disease-based programs on education and accreditation side, which will better all the parts of the team. And at the end of every year, we share with our partners the annual report, the medical report, because we share our results and publishments and what we have achieved medical-wise, management-wise, and research-wise. So you know that in the last 10 years, 15 years, medicine has turned into individualized approach. And in the past, I've been in healthcare management for 31 years by now. And in the past, it was treatment protocols that guided our physicians to treat their patients. But presently, every case is acknowledged to be decided differently. So there are several councils, starting from oncology to neurological sciences, thoracic oncology, cardiac council, pediatric oncology council, to make sure that every individual is discussed and we offer them the best healthcare that we can. And technological wise, of course, every good team desires to work and to present their services with the best technology. So for robotic surgery has been one of them since our opening. So we provide the colorectal cancers, rectum cancers, lung cancers, breast cancer, urological cancer, and gynecological cancer with robotic surgery for appropriate patients. And cardiovascular surgery is one of them, thoracic surgery as well. So we provide robotic services in knee and hip prostheses that I will discuss. The stem cell laboratory has an intensive GMP standard, and advanced nuclear medicine services and brachytherapy, I can count some of them as the high-tech infrastructure. So since the opening, Cancer Clinic has been the most comprehensive department in the hospital. We provide personalized services for medical oncology. In nuclear medicine is no more only a PET or gallium treatment, but of course the ablation, tumor ablation therapies and liver microsphere treatments, radium treatments, which are not only diagnosis, but treatment modalities that nuclear medicine can provide. So all kinds of cancer surgeries are accomplished because we choose our clinical chiefs from oncological surgeons. They use, if necessary, on HIPEC application and cytoreductive surgery for minimizing the tumors. And of course, radiation oncology is an important part of the treatment. So it's a 360 degrees approach for personalized treatment for pediatric and adult patients. They start to discuss the situation of the patients in the council. They do the appropriate diagnosis after the surgical treatment, or maybe before the surgical treatments. Medical oncology and immunotherapy comes into life, and then if necessary, radiation oncology is accomplished. Of course, we provide the follow-up program if they go to their home that is outside of Istanbul. So I will not go each one by one, but each majorly seen oncological diseases has in the primary line, you see the diagnostic infrastructure, and you see in the last line the treatment infrastructure. Surgery is not only the treatment structure. So with every oncology type, we have other kind of processes and infrastructures that we utilize. So we use artificial intelligence software in our medical oncology department since 2018. So, you know, medication that is calculated for each patient in medical oncology, it is usually in the world, it is calculated by the doctor. And now only the AI program, we enter all the data, the biological data of the patient into the program, and it provides the calculation of the medication automatically, and the doctor just controls. So we have 100% of correction in the volume of chemotherapy medication in each session. So in nuclear medicine, as I mentioned, we have radioactive iodine treatment processes, treatment of metastatic bone diseases, and treatment with lutetium treatment are perfectly done. Besides utilizing other kind of radiological interventional treatments. And in radiation oncology, we have built up a very upscale infrastructure. We have the 4-dimensional LINAC, and presently it's the MR LINAC with 1.5 Tesla is being installed at the moment. So it's the 20th 1.5 Tesla MRI of Elekta that is being built in Istanbul, in the world. So this is the one in Istanbul with Elekta. So what it provides is, maybe you're familiar with MR LINAC, instead of having 25 to 30 sessions, in 5 sessions you can finalize radiation oncology. And the most utilized cancers are brain, lung tumors, pancreas, liver, prostate, rectum cancers. So we utilize 3-dimensional and 4-dimensional brachytherapies for gynecological cancers and prostate cancers. And sometimes they don't have to go through an operation if they do the brachytherapy. And for children and for adults, we have bone marrow transplant centers as well. We do all kinds of transplant procedures. So the most attracting clinics is the Regenerative Medicine and Stem Cell Center, because in 2014, when we built up the GMP laboratory for stem cell, we have been, we're still the first and only laboratory that is in a hospital roof. So we have an RD center for stem cell as well as clinical approaches. So we treat a lot of neurological disorders and a lot of diabetes patients. And recently we have utilized the COVID for the last year for COVID patients. So we have licensed products by the Ministry of Health in Turkey. And also we use stroma vascular fraction for, this is a fluid injection of cell in the joint cartilage like knee or hip. So the utilization of cells, mesenchymal cells or fibroblast cells or cartilage cells is utilized for different medical schemes that conventional medicine is not anymore helpful to the patient. With each specialty, we're subspecialized. We don't have a charismatic general surgeon that is doing everything. So we have the different programs from colorectal to hepatobiliary. They work in teams, to bariatric surgery team, breast diseases, hernia, and endocrine surgeries. So every team has different focus, and this is why we have better medical outcomes, I believe. In gynecology obstetrics, of course, there is the gynecological oncology team, adolescent health, risky pregnancies and perinatology, and we have very good results in the IVF department. With the cardiac health, we have very advanced and accomplished cardiologists that really our cardiovascular team, they take away the cases from the cardiovascular team. They do all kinds of advanced cardiac interventions from angiography to transradial angiography. So they do the electrophysiology is the different branch, and conventional interventional cardiology and diagnostic cardiology are different branches. With our cardiovascular team, they do the robotic bypass very frequently. So the person, especially for young people, it's very important that the sternum, there is not anything left in the sternum. They do only a very small inch of incision by the robotic bypass. They do all the TAVI applications, mitral valve repair, revascularization treatments as well. So with the thoracic disease and health, again, they do very advanced diagnostic procedures and balloon treatments in COPD diseases. And for COAF patients and cancer patients, it's very critical that they go through this diagnosis and they have a very concrete surgical follow-up. In thoracic surgery, again, we use robotic surgery and deal with all kinds of lung surgeries and cancers. Again, gastroenterology in the past was a very conventional standard procedure of diagnosis, but today with the advanced gastrointestinal procedures, it's very crucial that we diagnose, and maybe before going to the surgery, they do the cancer diagnosis, they do the double balloon enteroscopy, percutaneous endoscopic diseases, and for obesity, they do some procedures, and that replaces the surgery as well. So in vascular surgery, we have varicose treatments and all kind of aortic aneurysm procedures. Neurological Sciences, again, is a team that they work hand in hand with neurology, neurological radiology, and of course, surgical team. They do the pediatric and adult neurosurgery procedures for all kind of tumors, epilepsy. Especially, we started the epilepsy center with our neurologists, specialized neurologists on epilepsy. And if necessary, some 2% of the patients out of 10, they go to the surgery and have finalized, they are removed of all the epilepsy attacks at the end. And they do the DBS as well as cranial tumors and hypophyse tumors. Again, neuroradiology is one of the part of the team in order to diagnose and sometimes remove the aneurysm, and they don't need the surgery as well. So one of the leading departments is orthopedy and traumatology. Again, they are subspecialized, and the most advanced is the Spine Health Center. We receive a lot of international patients in the spine program, and children especially. And we have rehabilitation programs, trauma surgery, all kind of arthroscopy. Especially in arthroscopy, we use a robot for knee and hip replacement, which enables the patient to come into life, to their normal routine very fast. Again, as you can see in the Spine Health Center, we have all kind of spine deformities, aging spine, spinal traumas, and we serve to many local and international patients. Again, dentistry is not only an easy clinic. They have 13 specialties by now, from bone jaw surgery to all kind of implantology. So we have different specialties under the same roof in the dentistry. Liv Kits is our growing department. You can see from endocrinology to rheumatology, cardiology to cardiovascular surgery, from neurology to neurosurgery. We have all kind of specialized subspecialties in pediatry. Now, recently, we received another physician from Toronto dealing with only pediatric orthopedy. So again, aesthetic and plastic reconstructive surgery come from different sites for our upscale services for face and body rejuvenation. And we have a lot of reconstructive surgeries, especially patients that have burns, that are war injuries. So it's not only aesthetic site, but also a very good reconstructive site. So again, hair diseases is one of the department, either in the control or too late, we delay the loss of the hair. But if it's in a point that already the damage has been there, so the hair transplant unit is working and helping the admissions. We have, again, a subspecialized clinic in ophthalmology with all from the retinal surgeries, cataract surgeries, and in cataract surgeries, they use multifocal lenses, which helps us to clear away the short sight and long sight errors in the eye. And we have also a pediatric ophthalmology department. And in urology, it's very important that all the upscale diagnosis and treatment modalities are there. So we use not a conventional biopsy, but prostate fusion biopsy to make sure that we find the red point where in the biopsy and then operate accordingly. Again, prostate brachytherapy is one of the choices for the patient if he cannot be operated. And we have an artificial bladder and bladder cancer programs, and we try to do it if possible with robotic surgery, all kind of cancers. And algology is one of the supportive departments full-time for all kind of cancer diseases, orthopedic and muscular diseases. So in the ENT department, again, they are subspecialized for head and neck tumors, vertigo centers, pediatric otolaryngology, and all. I will not count one by one each department. Again, we have a very comprehensive internal diseases. So we consult to each other for the internal disease. Physicians don't take care of all the internal problems, but they refer to gastroenterology, cardiology, rheumatology, nephrology, infection diseases when needed. And in endocrinology, for the follow-up diabetes, you can see this on the picture. We have Libreta that you don't have to take blood from your finger 5 times a day, but for 15 days automatically, the data from this small coin goes into the doctor's and the clinic's data. So they follow up the diabetes patients and arrange the medications. So far for the clinics, and I'll just in a few slides I'll collect, because we're a corporation that is serving to the public. We do a lot of projects, screening projects for our public, and try to create awareness of different diseases. We have very extended checkup services on various programs in the exclusive checkup center, especially for our international patients. And Liv Hospital Vadi, the last version of our hospital, which is the largest one, is coming on the European side of Istanbul, which is very close, only 10 minutes away to Istanbul airport. We are ready to receive our patients there in May. So it's only 16 weeks by now that we have the pleasure of providing the upscale services and continuing there. So we are trying to create the future of healthcare and trying our best with our international patients and not leave them when the procedure is over, but try to follow up our patients online, especially in the last year. Online and online programs have entered into our life tremendously, because sometimes in the diagnosis stage, sometimes after they reach their home, we don't want them to lose their contact with our physicians. So we try to follow up all. So thank you for your
Dear Meri, thank you for your really nice presentation, very informative. We have one question before you leave us. Coming from Ukraine, Dr. Tatiana is asking for you, saying that how I can visit Liv Hospital. I would like to visit Liv Hospital. How and when this can be arranged and possible?
If you can pass her communication numbers, we'll be happy to greet her. Now we're just after the session. We'll just call her and invite her.
Sure, we will share with you the contact of Dr. Tatiana. And also we would like to invite all our visitors and participants to check their profile and confirm the B2B meetings, because there is a lot of requests from the buyer to the exhibitor to the buyers. Please, we would like to invite everybody to have the possibility to interact in B2B, actually, to request the B2B with the exhibitors. You can ask all your private questions, and you can build your cooperation as well directly with our participant from exhibitors, from the hospitals, from the travel agents, facilitator. We have a different service provider of healthcare services in the exhibition platform. I would like to invite all our visitors actively involved next 3 days, today, tomorrow, and after tomorrow, to interact on B2B platform and arrange a B2B meeting and have the conference call and video conference call face-to-face with our supplier and exhibitors. Maybe Mrs. Meri, you have 1 minute to close your speech.
Thank you for the opportunity, and I want to share that we receive all our international guests as part of our families. It's not just a fancy word, it's just what we're trying to do, because they're in a foreign country, probably frightened of the difference in language. So we have the international team on board that don't leave them, especially the CIS team are extreme in handling all kind of their needs in the hospital and where they are staying. So it's very crucial that we embrace them and try to decrease their anxiety due to their treatment and being in an international country where they are not aware of the cultural differences.
Thank you very much for your participation and for your contribution and support. As our ex-president of Turkish Healthcare Travel Council, you served 4 years, actually, long term, one of the longest term as a president. You serve the council with your vision and with your understanding, and you bring a lot of different motivation to our council. Thank you for that as well, and thank you for participating.